We're back with the Inside the Block podcast, and I am here with Dr. Jill Collins of Lex Enhance. Thank you so much for joining me today.
Thank you for having me.
Yeah. You're currently in Wildfire Yoga.
Yes, we are in a pop-up in Wildfire. So when you walk in, or as soon as you walk in, and then we have a little side room too. So we are building in between Eppings and Rag Peddler, our aesthetic clinic.
Okay. That's
I'm really excited.
Yeah.
I'm waiting for the day.
Yeah.
Even though I love being at Wildfire because we can hop in a yoga class and there's a great like female commodity here.
Totally. It's such a really welcoming community at Wildfire.
Yes.
Like I think I mentioned to you before, we had interviewed Kelly on the podcast before too, and it was just like it's an amazing like compound I think that she's really building.
She's incredible. So my husband had found Kelly before I moved here. I was taking care of my grandparents back in DC, and he was like, oh, there's this great yoga studio, because we live downtown, 5 minutes from us. We walked in, and it was when she just had the 2 yoga studios. And then when I started thinking about opening up my own clinic, Kelly had invited us in here, and we weren't quite ready to make the move, but she was telling us about everything she was doing. So we got to walk through the construction before it was built. And now you walk in and there's a whole wellness center, and there's so much life and color. And I don't know, it just brings different people in every week. It's fun.
It is. And it's just like so welcoming. I just feel like I was telling somebody outside too, like sometimes you go to studios that are based around wellness and you just don't feel as welcomed, but here it's like the complete opposite. This is my vibe. Like I want, when people walk in somewhere, I want you to feel like you're home. Absolutely.
And Kelly makes everybody feel like she's at home.
Well, tell me about LexEnhance.
Okay, so LexEnhance, we started back in May. I was telling you recently that I transitioned from acute care hospital-based practice. I did open heart surgery, robotic surgery, transplant surgery, urology, general for years, mainly pediatric.
I just
cardiac.
think you're too pretty for that. It's a little weird to me. Like,
which is funny that
I do surgery.
My first aesthetic eye opener was when the girls at work started wearing Latisse.
Okay.
Because the only thing that you can see is your eyes, just your hats, mask over the nose. And all of a sudden I looked across the table at one of the other first assistants, because we actually help operate. And I was like, what are you doing? She said, I'm wearing Latisse. I'm like, well, your eyelashes are like kissing your eye, protector wear.
You're
like,
fluttering.
You're literally fluttering at me. And then, everybody started getting Botox and stuff. So that was kind of my first introduction to, my OR people taking advantage of aesthetics. But then we worked with some plastic surgeons, and they're always fun. They're witty, they're humorous, good sense of humor. And so
plastic surgeons
have great senses of humor. They have great urologists are the best, I will say. They always get it up for you.
Their humor is just so hard.
It is so hard. Like the goal.
That's the goal.
I know. I'm already taking it to the next level.
No, I love it. I love it. We're 5 minutes in. Urology jokes. It sounds like
jokes.
Always.
So, they're my favorite people. Don't tell my husband, because he's a surgeon.
Okay. Absolutely. Don't watch this episode.
Do not tell my husband. I love urologists better. Anyway, so I had my own health incident before I moved here, and it kind of debilitated me to the point where I could barely walk. I was definitely not up for standing for 24 hours straight anymore in cardiac surgery. And my husband said, well, why don't you look at doing plastic surgery? Like, you've always enjoyed skincare and learning new things. And, what about weight loss is something new? And I'd been working with diabetic patients and doing transplant surgery. So I thought, sure, so I took a job where there was a plastic surgery center here in town, and then helped start their weight loss program. And as I listened to more and more of my patients, it became so clear to me that there was just not the resources to support the continuation of that healthy lifestyle. So many people have transitions and life roles where you've lost a parent, a family member, or maybe going through a divorce or a hardship, and you let yourself go because you're so focused, your energy is elsewhere. It's not on yourself internally. And then you look in the mirror and you're like, oh my goodness, what happened? And so the mental health component was huge. And so we brought in a device called Exomind that actually helps with insomnia, depression, binge eating. So you actually lose 3 pounds a month because it kind of numbs out the noise. So it helps you process and focus on your day-to-day tasks. And then it helps with PTSD and also anxiety. So we've had a few patients that have been treated for that, and it's been miraculous.
What is the process like? Like how? What
So
is?
the process is it's less than 20 minutes. You sit down, and my dad has the best description. He calls it like he feels like there's like a woodpecker like tapping outside his head. It just sounds like it, but it's non-painful. It doesn't hurt. It is transcranial magnetic electrical stimulation. So they've used it for years in hospitals to help with depression. And this is the first FDA cleared device that they have in an aesthetic kind of outpatient service practice model. So we brought that in, yeah, because that was to me one of the big components. Also, genetics always plays into anything, and then I look at everybody's lab work because I love to be the detective, like what's really going on underneath. And I think we get scared to go to regular private practice or primary care providers because you don't want to know. Like
No,
you
you
kind of
don't.
know
I've
that
been like
something's going on.
putting off a mammogram. Like I never. Like
Yeah,
it's
it
just.
hurts, but just do it.
Yeah, I know. I need to just like.
Just do it.
I know.
Yeah, and that's the thing is like sometimes you're so afraid to know what's really going on in your body, or you see your family members have these ailments and you don't want those. So I think coming to plastic surgery or coming in a place where you don't feel that kind of intimidation or that white coat syndrome that a lot of people have, where their blood pressure skyrockets up to the roof because they're so nervous, like, oh my gosh,
I'm
they're
in a
gonna find
clinic.
something
Yeah,
wrong with me, right?
totally.
So here's a different, I feel like this is a great model where I can still bring the health and wellness, like the mental health component, or like this device to my right.
Yeah, you have to talk about this
Which
device.
we'll talk about. So is also, this is for pelvic health, floor and rehabilitation. So I can bring in the aesthetic component, but I can also bring in the wellness component because it's not just the outside we're treating, it's the inside. Because when you feel good on the inside,
Totally.
you radiate it on the outside. So I love this device.
Yeah, Emsculpt, right?
So Emsculpt Neo and Emsella. So they pair together. This is my giant roll of throne. As you can see, it looks like a toilet. And that is because it helps with pelvic floor rehabilitation. And this is not just for women, gents, this is for you too.
Yeah.
So it helps with not only urinary incontinence, which would be stress incontinence. So let's say maybe you cough, sneeze, and you leak a little bit, or nocturia is something that a lot of people have as they get older because we lose the muscle tone in our pelvic floor that holds our organs. And so you're getting up in the middle of the night and peeing all the time, which also contributes to poor sleep quality
for your partner as well.
Correct.
Yes.
So that helps with that, but then it also helps with sexual intercourse. So let's say you have difficulty with intercourse, it's painful, or as we hit menopause, and after we start to dry out a little bit.
Yes.
And so by increasing the muscle tone in your pelvis, you increase blood flow. And so it helps with not only pelvic floor sexual and discomfort, but also helps with erectile dysfunction.
Wow.
So men benefit from this too. And then you're building that muscle in the entire area. So you also, by proximity, help with low back pain. Okay. I sit on this all the time because, like I said, I went through surgery. This helped me. Also, I have something called levator ani syndrome, which is this like very weird thing where it's where like your pelvic muscles get very angry and flare up on you. So this actually helps relax me and like build some muscle back up so I don't have pain anymore. Yeah, it's awesome.
And so the idea is you sit on it and you have to sit on it in a certain way, you were telling me.
Certain way, yeah. So you want it in between your urethra and your anus, so the bits in between. So love that. So you just want to make sure that you're sitting centered on it, and you do 11,400 Kegels. So we recommend that you do 6 treatments of this, and you'll probably need a touch up once a year, but the benefits of doing this versus paying for adult diapers and sitting in your own urine as you're an adult is far outweighs it to me. So
I love, and I just love like you come from this medical background and you have such a, this like scientific approach, but like so much about your approach is like, it's not pills, it's not chemicals, it's not like these quick fixes. It's like these, like you're using technology, like
to advance your quality of life.
Absolutely. And you're bringing a lot of things like this. I don't think this exists in Lexington. You have the only you have to. I didn't even know it existed, let alone that it was right here in the warehouse block, No,
I do know that there are some other people that have the M-Face, which is on that XIM platform, which is right behind you. But I don't think that they have all the features with that. And so thinking about holistic, that was the other thing, is I had so many patients say to me, there's still a stigma behind Botox and fillers. And that's completely understandable. And for men too, men are starting to pay more attention attention to, especially their neck, wanting that tightened. Sleep apnea is something that's a secondary to having kind of like facial laxity and bulk underneath your chin. And this treats that as well. It also treats stroke patients, and somebody's had to have Bell's palsy. So you have muscle asymmetry, or one side might be stronger than the other side. I can actually tune the frequency of the electrical stimulation to make your muscles contract more on one side or the other side to retrain or re-educate them. It also treats TMJ. So it's awesome because it has those health functions, but in the same aspect we talked about, like with Botox, you're killing the muscle. You don't want it to move. And so we start to get in surgery the droop, and you start to get this droop, and then your eyes look tired and you want a blepharoplasty. So then you spend a ton of money on surgery, where here we actually recreate the muscle and build it back up to push back the fat pad that herniates out and bring back your eyebrows up. And then we use radio frequency to tighten it out. So you're using your natural body to exercise and retrain the muscles, and then promote collagen using radio frequency and heat. So kind of cool.
It's incredible. I mean, and it's also just so against like the past, 10, 15 years of what we've been taught, especially like as women, about like, so Botox is the answer. It's like the second that your wrinkles first start in your forehead, and therefore like you just have to freeze them. And then like the way my dermatologist explained it was, you don't want the paper to crease. Like every time a piece of paper creases, it gets, and so when you're freezing it, or it's, you're not making those muscles move, then there's no more creases, and then all good, we're all done. But it's like when you're just
stop,
exactly,
then
and
everything
drops. Band-aid over it.
It's temporary. Yeah, absolutely, it's temporary. So we want to age gracefully. And I'm not against Botox or fillers. Like, we'll probably bring them in because I think it's a nice complement to some of the practices that we have. But I do think that there are ways to do it holistically. And if we can bring those in and it satisfies everyone. And again, as we get older, every time you get Botox, the price increases. And I'm like, is that $2,000? Am I $2,000 worth of wrinkles? Yeah. Like you start to price value yourself. You like, really wow. And nobody wants that. Like it's supposed to make you feel better, not.
Totally. And I'm always like, what's in it? I'm always like, okay. And it's also sometimes I've heard from my girlfriends too that like there's this conspiracy that there's like it's kind of gotten weaker over the year. Like it doesn't last as long.
This is true. So you start to build a tolerance to it.
Totally.
And so there are some people that are completely non-responders. So like these treatments that I have are alternatives for those patients, but then you do start to, like with any medication, you reach a tolerance point, right? Where your body becomes really used to it. So if you start getting Botox in your 20s and you're exposed to it longer, your body recognizes that. So the impact or the effect of it is not going to be as great as it was when you initially started it. So Zeman is another toxin that is a smaller molecule and it's more of a natural protein. So patients, they're starting to have more evidence come out or literature suggesting to start younger patients on that. So that way it lasts longer in their body, and, we'll see where it goes because it is a newer product on the market. Yeah. So maybe in 10 to 15 years, there's something different that they're going to have out. I mean, medicine's always changing. I mean, I think that's why I love medicine is that it doesn't stay the same. It's not constant. And the cool thing about being a provider is that, and having my own space is like, I can bring in new technology or new things that have great evidence-based practice and care and quality, or look at what we currently have and is it really the best practice or the best model for our patients, and talk with them about it. So
yeah, and I like your approach too because it's like it's just as much science and medical based too, but like there's an art to it.
There really is.
Yeah, it's not like cut and dry and everyone's the same.
No.
And, one size fits all.
It's not. Yeah, and the first thing I do is I'm like, just get on some good skincare.
Yeah. It's called sunscreen.
Sunscreen, yes. We were just talking about this bougie sunscreen that I found that I was like collecting from different hotels because I couldn't find it anywhere. And so I called the guy who has the company and he said, oh, you're my client. And I was like, well, yeah, because I want this stuff. And like, I don't see it anywhere. And he goes, well, I'll send it to you guys. And like, so now we have it. And he's like an inventor of CeraVe. So
which I religiously use. Like I use the retinol. That's like my body moisture. Like you were, I was like, there couldn't be any more rock star to me.
And it's just like, it's like having like, like your Toyota and then having like the Lexus, so it's like that kind of quality on top of it because it's a sunscreen with growth factor. I mean, come on, Who else has that? And it feels like butter.
Yeah.
Anyways, I could talk about skincare all
I
day.
love it. And I love a hyaluronic acid. You said that
And it
earlier. I was
has
like,
that
that's like
in
a
it.
magic word.
Yeah.
To me. Yeah.
But see, you understand
Yeah,
skincare. And
yeah.
and a lot of patients don't understand just like the bricks and mortar of having good skincare is the foundation for everything else. Because it's like putting lipstick on a pig, right? If I can do everything in the world and hammer you with every kind of device or, injectable or neuromodulator, and at the end of the day, like if you don't take care of like what's
You're not
underneath,
washing your face off at the end of the day, or
that's right,
drinking
like
water. Yeah. Like, yeah, you have to keep up with it.
Got to keep up with it. Yeah.
Totally.
And you can start at any age because my husband is in his mid 60s and I love him to death, but like he now will steal my stuff. Like we made a whole kit, like a men's skincare, just because it's stuff that feels great to him.
Yeah.
And I know that he'll use because it's easy and simple. And like his skin is banging. I'm like, that's right. He glows.
Absolutely. So it's never too late.
It's never too late.
Right. Even for the men.
Even for the men. Yeah. And men, like I want the men because like I think men care just as much, but it's again that
but they're like not allowed to care.
It's that taboo.
Totally.
And like, you know what? Rock yourself. Like come in here. Like come work on erectile dysfunction. Come work on your abs. Like tone them up. Like make yourself look better. Like there's no hate here. Like and there shouldn't be.
Lean into it, fellas.
They should.
Yeah. It is funny though, in our society how like women, I mean, I guess, it's always been something from the dawn of time. Like women just get to be vain, that's their lane, we'll support that. And so we've always been able to be a little bit more like open with caring about our aesthetic value. And so, but men do all sorts of things that I think we see behind the scenes, and they're certainly more like insecure with aging.
And they hide it. Yeah. They start working on stuff or they're interested in it. And like, you'll find like, you'll see your husband like starting to like bring in some nicer clothes or some nicer colognes that a friend told him about. I'm like, yeah, it's there. Yeah. Like you care.
Absolutely. Yeah. Or like they'll sheepishly walk into a nail salon to get a pedicure and they're like always looking around. I'm like, there's no judgment. Like, well, I'm so glad you're taking care of your feet.
I am glad that your feet look good.
Absolutely. Like you're doing us all a favor. Like the world.
Thank you. Yeah. No, so I love it. And then the other side is like, we're doing weight loss. And so
tell me about the weight loss stuff.
I love the weight loss. I can't say enough great things about weight loss. I know that there's a taboo with that also, but from a medical standpoint, when I look at the medications, I pull labs and I want the whole health history. And I love to deep dive in your chart and like pull things out of you. Then I'm like, oh, you didn't tell me about this or that, or why is that medication on your list? So it's kind of like, sometimes it's like pulling out the pieces out of people until you get everything. But you learn a lot just looking at labs.
Like a puzzle.
It's kind of like a puzzle. And there are things that we can change and things that we can't change, right? And genetics is one of those. So you could be somebody like myself. Everybody kind of has a heart attack in their 30s in my family. You wouldn't know it, but they do. My father had a heart attack at 46, dropped down basically dead in front of me. I was 16. It was like traumatic. So that's why I got into healthcare.
Oh, wow.
But he was playing 3 hours of tennis that day, doesn't smoke, doesn't drink, doesn't eat bad. Like you just never know. So like even my cholesterol's high. So when I screen patients, like you have no idea kind of like what's in your
genetic makeup,
on top of it. And so the weight loss prevents that, and Alzheimer's is a huge thing. So they're starting to look at more and more studies that these weight loss medications are really their anti-inflammatory medications. So Alzheimer's, PCOS, endometriosis, renal disease that just got cleared for, cardiac disease. They're looking at all kinds of things because if you look at a fat cell, basically, it can swell up 6 times the size of a regular cell. Well, what else does that? Cancer. Right? So your body kind of looks at the overweight process as being a foreign, right? So then you're constantly inflamed and you have this immune systemic response to it. So these medications are actually combating that long-term implications of maybe being overweight, or you may not be completely overweight, but you want to lose like 10 pounds for a wedding, and keep the weight off. But knowing those lab values and what you have before we start you on the medication and what you look like kind of determines whether or not I want to keep you on that for the long run, or if we can wean you off of that medication with great cognitive behavioral therapy, which is kind of like exercise or diets and mentality. So, yeah.
Wow. No, I love that holistic approach to it too, because it's, I've been on every weight loss medication I can like possibly imagine, like from, I feel like age 16, it was like everything from, Yeah,
And
everything.
it's the peer pressure.
It is, of course.
You feel it.
But it's also like, oftentimes you'll go to like a clinical place, like something like a legitimate place, and it's very much like, here's your medicine, good luck. And it's like, yours is like, let's look at the background, let's talk about longevity. Like, you, of course, when you lose it and you don't have any skills afterwards to keep it off, it's certainly going to be coming back. Yeah,
right. Which is part of the reason I wanted all these modalities. I'm like, how can we help you live your best life the longest that you can? There's a nice quote from actually the manufacturer. One of the conferences I went to, he's like, we want to increase the miles in your years. And I love that, because I'm like, you should feel your best like every year, because you know what is the point if you can't get up and do things know that you love to do? It can be depressing again, and that cycle repeats itself.
Absolutely. So well, and I also think there's a lot out there too where it's like, well, you're 40, you might, it's just like slow decline to your death, and it's like, no, like these are some great years. Like I turned 40 last year.
Living my best life.
I love 40.
Thank you.
Yeah, absolutely. And like I feel better.
Welcome to the club.
Thank you so much. Thanks. Like, well, I just we're filming this in almost March, and I just turned 40 last April, so I like for an entire year I was like, I just turned 40.
So when's your birthday?
April 23rd.
Okay.
What's yours?
So mine's March 20th. So so we're
great.
close.
Yeah, very close.
I'm a fiery Aries.
Yeah,
so.
I would say you're an Aries. I could tell. Yeah,
you can tell a little spice.
I love it. Yeah, it didn't take no for an answer. I love all that.
No, I don't. I feel like I'm a guinea pig in almost my entire career. I've been like the first to do things. Like I was the first new grad they ever took into
like a pioneer,
like in cardiac surgery, and I was like, here we go. I'm kind of the first OR nurse that they took like in my doctoral program at Duke. Like they all told me like OR nurses wouldn't do good, and I was like, well, I'm gonna show you.
Yeah.
So
yeah, just watch me, baby.
Just watch me. Right. And I kind of love that, and I really want like other people to not be afraid to follow their dreams. It's scary. It's terrifying. I have to tell you, like, starting my own business has never been nothing more stressful in my life.
Sure.
Like I could do surgery all night long, like somebody come in with like a dissection or a transplant, and I'm like, great, let's go. But like doing my own business, I never had expected the challenges that it's been.
So tell me, what was the most challenging?
So one of the biggest challenges was just location. And like, I am so thankful for Chad Walker and having an Erin Goins, because she is the one who connected me with Chad, being in the warehouse block, because with every business, they're like, well, where are you going to be? Location is so important. So we looked for months, and we had some deals that kind of were okay, and then they fell through, and we're like, there's a reason it happened. And then the location here on the block opened up, and I wanted to be downtown because I think people are afraid of coming downtown, and I don't want them to be afraid to come downtown. There's so many people that work downtown, the transitional people coming in and out for Keeneland and, events downtown and Rupp Arena, tourism. Mm-hmm. I mean, it's great. I live downtown. I love it. So I wanted my clinic to be accessible to the downtown population. And then this came, and I was like excited. So yeah, I mean, just finding location probably took us 6 to 7 months to find the right place.
Yeah.
Yeah.
Because there's so many things to consider, I'm sure.
There's a lot of factors, like what med spas are competitors around here. And I wouldn't say they're competitors, because everybody brings something different to the table. But they are, again, you don't want to be right across the street from somebody, because that's not okay either. Yeah. But being down in the warehouse block, like I love, because it is like right downtown, like they're building around here. You can walk to everything downtown. Wow. I mean, I love it. There's like, again, like Kelly and all the small businesses, Erin, Avina, all of the women's small businesses. Totally. And then there's a lot of fitness and health in this area. There's at least 4 or 5, personal trainers right across the street, gyms, Pilates, there's silks down the street, dancing, Tai Chi. I mean, you name it. It's here on the block.
Yeah. Even Kentucky Ballet.
Correct.
There's a lot of movement.
So much. And like, you have great pizza.
Yeah.
And
absolutely.
Great bread.
Absolutely. And great barbecue.
Great barbecue. Yeah. So
the only sake distillery in the state of Kentucky.
I know.
It's just like, it's such an eclectic mix. That's the best part, I think.
And I love like the history of it. Like when I listen to Chad Walker's podcast with you, like I'm a history buff, which is like why Erin and I connected. And we like the Civil War history, I find fascinating, because I grew up near like Antietam and sort of those places. So every Easter it was like, we're dragging you to Gettysburg in your, nice Sunday dresses.
That's
like,
my kind of parenting style as well.
Yes.
Like, you're going to come see this old house.
I'm going to drag you across the bloody lane on Easter Sunday.
Can you believe this happened here? My kids are like, oh.
They're like, oh, rolling their eyes.
Not again.
But no, I geek out on it. And like, I found Aaron, because as a new person in Lexington, I was like, well, what do I do to learn? And we love food tours. And so I was like, let's do a food tour. And
He has the best one.
Then the history with it, I'm like, this is amazing. And so, yeah, it's the history here with the bottle shops. And like, yes, there were bodies here at some point. So I'm waiting for a ghost. I haven't heard one yet.
No, there's cholera ghosts. I think they're probably going to leave you alone. You're too cute.
they're fine. They're good ghosts.
Or you're going to walk in and they're sitting on the pelvis simulator.
Yeah, they're just like working out their pelvic floor. They're getting it up.
Everyone deserves that. So tell me everything else about LexEnhance.
LexEnhance. Okay, so we have body toning and enhancement. Okay. We have mental health with the Exomind. We have pelvic health and rehabilitation. The other thing that the Emsculpt Neo does, other than toning and tightening, and you have 30% fat loss, 25% muscle increase, is it also helps with physical therapy.
Wow.
So with injury rehabilitation, so if you have, let's say, sciatic nerve pain, we can actually chase that sciatic nerve pain and help stimulate the muscle rebuilding and also relaxing it too at the same time. We do hair loss, so we have Nutrafol. I can do medications for that. If it comes to that, Obagi just came out with products called, I thought it was sitting on my back shelf here, but BioStim, which is actually like Latisse. There's a new Soul line, which is hair enhancing. So especially for women, we can fill in sort of the areas that, are losing hair and recreate that hair growth. So that's phenomenal. We do weight loss, of course, injections like B12 or lipo injections or NAD. And then we'll have an IV bar at our new place, which I'm really excited about.
Are you going to have like a hangover special?
I'm totally going to have a hangover special.
So then I just party in warehouse block and see you the next day.
Walk downtown and like get your IV, and then we'll have a sauna and a steam shower. So then like after you complete detox, a mental health detox, where like you just want to de-stress. So it's like hit the sauna, hit the shower, come get an IV, and have the Exomind treatment. So yeah, I want it to really be 360. And then hopefully we'll bring in hormones soon. I have somebody that's looking to partner with us to do that. I'm going to take some courses on that. And then of course we'll probably be doing some toxins. So I've got my training in that, and everybody wants a little plumping once in a while. So
I mean, is there anything you don't do? That's a huge
surgical
list.
here. I would love to do surgery because I love surgery, but we don't do it here. So so I mean, whatever you're kind of looking for, or you just want to come in and hang out and like sit down on the Emsella and chat with us, like I love a good day like that. So
tell me about the new space.
So the new space, so that's again between Eppings and Rag Peddler. Right. So we have about 3,000 square feet. Cool. There's going to be 5 patient rooms, and then there's going to be kind of lounger. We'll have the Emsella there. There's going to be a locker room, a changing room, a photography room. There's a couple bathrooms, the sauna, the steam shower, and then also 5 IV suites. So we can do buddy abs back there. So if you and a friend want to do abs at the same time in the IV space, we can do that. If you want to get your IVs there, like rent out the area for like the weekend. Let's say you did like an entire Keeneland like weekend and you're completely hungover and you just want to get ramped up. We can like rent the space out to you.
This is like music to my ears. I'm so excited. Like, Keeneland tickets just went on sale.
I know. I just got mine. Of course, I wanted the grandstands because
I love the grandstands.
The one time we went to the Derby, it rained so bad. It was the year that the winter got scratched.
Oh.
And we just felt like we were melting. And we were like, never again are we going to like the horse races. We're not looking at somebody's hat. I think I got tickets for the Thursday, but like that was the only grandstands left where I get like multiple tickets. Sure. But I love betting on horses. I never thought I would, but
same.
It's so much fun.
I have friends now that often go to like Red Mile, like they're into like the slots and stuff. And I'm always like, that is not my speed at all. Cause it's just like digitally looking at how you're losing money. But I become a degenerate gambler at Keeneland. Like there's something about horses.
There is.
Like, take all my money.
I know. Yeah. Well, I don't know. You get invested in them. You see them. Like you interact with them. It's part of the culture here.
Totally.
I love the history behind it. I actually found out that I have a bunch of relatives that are from Kentucky. So I'm like, I am like a true Kentuckian in my blood. So we have to bet on horses. My parents came and my dad was like, I don't even want to bet. I just want to go stand by the horses so I can feel them like when they run by the thunder, and I'm like Jurassic Park.
Yes.
Okay.
Exactly. Gotta feel the action.
So we love it. Anyways, but our space is hopefully will be open in May to June.
I was gonna ask. Okay, sounds great. May to June.
Yeah, that's cool. Yeah.
Perfect.
Yeah, and I hope I see you there.
Yeah, I would love it.
As a frequent flyer
you're gonna
in the
see
IV bar.
me in the IV bar, I'll tell you that. Well, and like so many other things too. Like it's, we've talked about, getting a little bit older, and like, I'm doing a few more things. Like, I try to like improve my routine here and there, and like, health stuff. But it's like, there's just so many options out there. Like you've opened my eyes to that. Like there's a lot of non-invasive things too. That really interests me.
Yeah. I mean, you should feel beautiful in your skin no matter what, but like just age gracefully. And like, if there's a way to do it where you're not frozen completely and you can kind of still look like yourself. Yeah. I'm all about that. Like,
for sure.
So,
well, thanks for chatting with me today.
Thank you for
really
coming.
like you.
I love you too. So,
I was like, this is so fun.
I had fun from the moment you came in.
Okay, great. Okay, awesome. All right, well, so we're best friends. So
yeah, come on,
bestie.
We can deal with that.
All right, sounds great.
We'll get bougied out together. Yes. Can't
wait. You're gonna have to name one of those IV rooms after me.
We will. The Erica IV.
Yeah, the Erica IV. Yeah. We'll have some alliteration. So thanks.
Love it.
Appreciate
Thank you so much for having me.
Absolutely.